Hi, this is Dr. Eric Winder. This video is about fascia and pain, or more specifically, about how to relieve pain by treating problems in the connective tissue called fascia. This video is an answer to a request that I have received countless times over the years from patients wanting a resource to point people to that explains what it is that we do in our clinic, and in addition, what is fascia and how does it cause pain and how can it be treated. So, to start with, first of all, what is fascia? Fascia is fibrous connective tissue. It's fibrous, it's made up of collagen fibers and other substances, and it is everywhere in the body. It makes up 20% of the human body. It covers bones, muscles, joints, organs, blood vessels and nerves, the brain and spinal cord, glands. It is everywhere in the body. It has two extremely important roles to play. The first role is structural. Fascia is a structural tissue. It connects and protects. It holds us together and protects us from injury. Fascia is very tough. It has the tensile strength of steel. It also helps to transmit force, and it allows for movement. Loose fascia allows our skin to move against our muscles. So fascia holds us together while still allowing for movement. Fascia also has another very, very important role. It's not very well known, but it is extremely important. And that is that fascia acts as our most important sensory organ, more important than our eyes or ears or any of the five senses. Fascia gives us the sense called proprioception, which means position sense. And what that means more specifically is if I close my eyes, I still know where my body parts are. I know where my nose is. I know where my right index finger is. I can take that finger and I can touch my nose. How do I know how to do that? And the answer is embedded in our fascia, in our connective tissue, we have 40 million nerve endings, specialized nerve endings that are sensitive to pressure and tension. And they are throughout our body. Those nerve endings, when we move, we're always creating pressure and tension within our tissues when we move. And that sets off those nerve endings to give signals to our nervous system that tells us constantly where our body parts are. And that is critical. We can't function without it because there are several important things that rely on position sense to function properly. Number one, all coordinated motion, which means everything that we do. Walking, talking, brushing your teeth, eating a meal, swinging a golf club or a tennis racket, dancing, anything and everything that we do requires position sense. All posture. Many of you watching this video are sitting right now. If you did not have position sense, you would fall out of the chair onto the floor. All muscular balance requires position sense. All joint alignment and joint stability require position sense. Without position sense, none of these things works properly, and that is where pain comes in. Now, all of us, throughout our lifetimes, accumulate what I call kinks and dents in our fascia. These are restrictions and distortions, stiffening in the fabric of our bodies that come from past trauma. And the trauma that causes restriction can include strain sprain injuries, contusions, repetitive stress, surgeries, concussions, whiplash, etc. And these physical restrictions in the fascia can in turn alter the feedback of position sense. And that can alter how well our body is able to maintain joint stability, joint alignment, muscular balance, posture, and coordinated motion. Glitches in that feedback can affect our ability to protect ourselves when we're moving, when we're functioning through our day. We can get pain from not having proper joint alignment, joint stability, posture, muscular balance. Everyone is affected differently. Everyone has different amounts of fascial restriction. So some people have absolutely no pain at all from their restrictions. Some people may have only minor achiness or stiffness occasionally. But that can also range up to situations where people have severe debilitating pain from fascial restriction. These are the cases where conventional medicine looks at the situation, they can't find anything on imaging, the MRI looks good, the blood work looks good, and doctors throw their hands up and say, we don't know what's wrong with you. Well, the brain can perceive injury even if there isn't injury, if it is confused by a position sense input. And also there can be actual trauma, actual injury because a joint is unstable and there's muscular imbalance and the body is not able to properly protect joints and muscles and tissues from the force of just daily living. The good news, however, is that restrictions in fascia can be successfully treated, and this can give tremendous pain relief, sometimes almost miraculous pain relief. That pain relief basically can happen because when stiffness and restriction is released from the fascia, then you're restoring normal flexibility and pliability to that tissue, which in turn restores normal feedback for position sense and proprioception, which means better posture, better alignment, better muscular balance, better joint stability, which ultimately means pain relief. Now, fascial restrictions can be involved in a huge variety of different types of pain because we have fascia from head to toe. So, spinal pain, headaches, joints all over the body, elbows, shoulders, knees, wrists, etc., ankles, pain after surgeries, pain after athletic injuries. The list is very, very long because we have fascia everywhere in our bodies. More good news about successful fascia treatment is that it is very gentle. When fascial therapies were originally developed, they had an idea that basically restriction in fascia could be released by stretching it. Now, today we know through research that fascia is actually too strong to be stretched. Again, it has the tensile strength of steel. And in fact, what they found in the research is that what's most effective is very gentle pressure. So fascia can be relaxed and released with very precise, gentle, specific pressure, causing relaxation and basically melting of the fascial restriction. And that is what ultimately restores function and restores good position sense, restoring muscular balance, joint alignment, joint stability, and so on. So a question is, when is fascial therapy appropriate? Number one, with chronic pain. Fascial restrictions very, very commonly are the primary cause with chronic pain, but even when they aren't, the state of being in pain all the time tends to cause muscle tension and muscular imbalance, which leads to the buildup of fascial restriction, and that just compounds and aggravates the chronic pain. So with all types of chronic pain, I highly recommend fascial therapies because even when it's not the main cause, it tends to still give great relief. Number two, acute injuries that aren't responding like they should. So when you have an injury and the pain is going on for a long time after you would normally think it would resolve, that very often is due to fascial restrictions that are caused by the original injury. This includes surgeries. Sometimes the surgery goes absolutely perfect and the imaging looks great and everything should be fine, and yet there's mysterious difficult pain afterwards, and very often this is due to fascial restriction that's caused by the trauma of the surgery itself. Number three, situations where you want to avoid more forceful therapies or forceful manipulation. Fascial therapy as it stands today is very, very gentle. It's very safe in situations with, for example, osteoporosis or advanced or severe arthritis. Number four, situations where therapies are helping tremendously. Maybe manipulation, physical therapy, massage, acupuncture, maybe they're helping, but they don't last. As soon as you stop care, the pain returns. In those situations, very often addressing and treating underlying fascial restrictions can finally achieve lasting relief. Now, I started doing fascial therapies with my patients 20 years ago. And the reason I switched over from traditional chiropractic is I got relief for my own debilitating headaches, which I had had for years. And other therapies helped tremendously, but I never got permanent lasting relief. When I got tremendous relief from fascial therapies, I started using them in my practice, and in 20 years of using these techniques, I've seen a very high success rate relieving pain. I highly, highly recommend looking into this type of treatment for anyone who has any kind of pain problem that interferes with quality of life. I hope you enjoyed the information in this video. I hope you've learned a good amount about fascia. Take care and be well.